First, it starts with this, you are worthy, this is for you, you must show up.
This episode will focus on building the community where rest is woven into the rhythm of how we work, not as an afterthought, but as a design principle, and where pausing is seen as wisdom and not weakness. So let's jump in. Esther, for our listeners that are in decision-making roles, particularly those leading movement organizations and advocating for health equity, how can they start weaving rest into their organizational and movement work?
I think it begins as a leader, but checking in with themselves, right? Like, how are you weaving this into your own personal life? Or how would you like to? I think one of the things I talk to a lot of the leaders, and particularly those who are working in, movement building, is you don't have to have mastered the thing before you can bring it to your organization.
Rest is such a mindset. It is very psychological, but also in the body. And so we had 40 movement workers, executive directors of movement organizations who were gifted the experience to come rest. So there was no cost barrier to them. All they had to do was say, yep, I'm ready to come. What we found was that majority of those in the role at the front lines couldn't create the space, that they would not create the time to even show up to something that had already been afforded to them, something that had already been presented to them. So first it starts with this, you are worthy, this is for you, you must show up. I think that establishing rest as an impact metric on their dashboard could actually be really powerful. A well-being metric that every leader has to pass the litmus and check the box, because it starts at the top. So it has to be modeled from the top and then cascade downward or outward, so to speak.
So I'm very curious, though, for those particularly who may work in larger healthcare systems, where you're saying, Imani, that sounds great. Esther, that sounds amazing. If you're an executive director of your own organization, you can create the rules. Can you, Esther, speak to what someone, an individual leader, an individual contributor, can do to influence system transformation?
Part of it is going to be like, if you begin to recognize that, like, when rest is part of how I show up for myself in my role or for my smaller team, in my little corner of this, mammoth kind of, organization that's happening, that is going to change the impact that we're having. It is going to change the outcomes we're having, even if in small ways, but they will be measurable ways. And I think that recognizing that small shift, you can be the ripple that begins to have people then asking the questions and then having the courage to just say the thing.
I'm curious, Imani, if you are aware of any micro policies or practice that create momentum towards some of the bigger shifts in our systems.
Micro policies, when I think about them, I think about this world-class kind of example in Bhutan, where the society is, the infrastructure is based on well-being. And so as part of the infrastructure, every policy has a vetting system. And in that vetting system, there are questions or criteria that it needs to meet. And so some of those questions could look like, will this policy increase stress or reduce rest? Some of these policies can look like, does it strengthen community or does it fragment it? Does it harm mental health? Those are some of the questions that we can start to ask so that it is a forethought and not an afterthought, which is oftentimes when the harm happens.
For more conversations like this, subscribe to our YouTube channel and learn more at meetattheintersection.org.